And sometimes it's not just about like racial background, sometimes it deals with certain genes that might be found across multiple regions of the world. All right, so what organ is this? Okay, remember, they're not talking about the female reproductive system right now, we're talking about the male reproductive system. So these are the testes, and what kind of cancer can we get there? Well, testicular cancer. So what we have here, localized, regional, and distant. Just like I said, the earlier you catch a cancer, the easier it is to treat. But once it starts spreading beyond the original region, it gets harder to treat, especially if it implants in somewhere like the lungs, the liver, and even in bone. I mean, it's very hard to actually dig through and excise the tumor from bone. So again, this is why often when it spreads to those very hard to reach places, they call it terminal cancer because again, if it's very hard to operate, you can't just pluck it out when you use a scalpel. All right, so when it's localized, that means the cancer hasn't left the testicle, and this is why it's important to detect it. Why? Most men, the vast majority, 99% survival, still survive after 5 years. So this is why you can look it up online if you're a guy, but how to do a testicular exam. And then regional means that spread beyond the lymph nodes. So maybe it's starting to go in the pelvic and inguinal lymph nodes. Again, those are, so it's now going through all the maybe it's going through blood vessels or lymphatic vessels and going to being absorbed in or being trapped in the lymph nodes. And as you can see, even if it spreads past the testicles and still around like the inguinal and pelvic lymph nodes, you still have maybe 4% of men don't survive, but the vast majority still survive. But what if it starts to spread elsewhere in the body, all over the body, to the brain, the lungs, the liver? Well, notice that is still most men survive, but compared to the 1% and 4% when it was relatively controlled, now it looks a little over a quarter of men don't survive distant or metastatic testicular cancer. So again, early detection is important. So it's very, very treatable if caught early. So what's the age most at risk? Well, remember, prostatic cancer mostly affects men in their late and near retirement age in their mid to late 60s. But the age most at risk for a testicular cancer, yeah, so a lot of the men in our class are probably at risk of this. But does that mean you will get prostate or testicular cancer? Thankfully, no. But this is when it often develops, if it does develop in a man. This is why testicular exams, and you can look it up on YouTube. Again, what should you do? You should actually, like in the shower, kind of feel the texture of your testicles and see if there's like, okay, your testicles should be not, it shouldn't be like mush. It is soft, but you don't want to like squeeze it too hard. You should just know the overall resiliency and how the texture, how hard it is. But thing is that if you feel something that's like a lump or nodule that's harder than usual, that's when you might want to schedule an appointment with the doctor to say, hey, is this something I should be worried about? The good news is that if you do get a lump, it probably isn't testicular cancer, but you don't want to risk it. So the thing is like, if it is testicular cancer, what might also happen? Well, you might have to also remove that testicle as well. But sometimes, like for men who do have testicular cancer, sometimes they actually freeze. If they are going to lose their testicle, they might actually produce semen samples and actually cryogenically store their sperm in case they want to have children in the future. Now, cryptorchidism. So the thing is that during development, so here we have the developing testes, but they actually start off in the abdomen. So remember, like the ovaries are also in the abdomen as well, right? So this is one similarity between male and female development. So the testicles also develop in the abdomen, but again, do they end up stay in the abdomen? No, not really, right? So they actually drop down before birth. So as a embryo is developing fetus and fetus is developing, then these will eventually migrate to the scrotum where it needs to be upon birth. So they do migrate via the inguinal canal and then end up in the scrotum. So what happens here in cryptorchidism? Sometimes this process, one of the testes or both might get stuck along the way. So this testes is now in the abdomen, and now this baby only has one testes in the scrotum. So one testicle can sometimes be stuck. So what happens is like sometimes surgery is needed, and then I remember like my friend, he was growing up, he said he went to the doctor for this, and the doctor actually pushed the testicle down from his abdomen into down the inguinal canal, and then put it down and then into the scrotum. But the funny thing is that I guess there was enough connective tissue that actually migrated back up in the inguinal canal. So he said he could. I never saw it, but he claimed he could actually push it down. But every time he pushed it down, it would end up back in his abdomen. But yes, so then if there's not enough connective tissue anchoring it down here, yes, I believe his story. So this is why this is cryptorchidism. So when it actually gets stuck, one or more gets stuck, this causes it to, this is what the condition we call cryptorchidism. So undescended testicles have an increased risk of cancer. So this is the other part why it's interesting to diagnose this, because again, if it's up here, it's hard to feel as well. So if it's developing cancer, that could be a threat to a man's health. Because again, if you have cryptorchidism and the doctor is able to feel the testicles in the abdomen, and they know this man has cryptorchidism, well, maybe he knows where to feel, because okay, he has a left testicle, but his right testicle is in the abdomen. Maybe I'll palpate the right abdomen to see if I can feel that testicle. But again, you have all the other things, other tissues as well, like adipose, muscles, and whatnot. So again, it's also another reason why cryptorchidism is kind of complicated. And the other thing too, I mean, there is compensation in a testicle that would be in the scrotum, but if it's in the abdomen, can that testicle descend and ascend when there's temperature changes? So usually when you have a testicle in the abdomen due to cryptorchidism, that means that that testicle is usually, or all the sperm in that testicle is sterile. Why? Well, it's being held in the abdomen. There's no real thermal regulation if it's all the way here, because it can't really move down here or anywhere away from the body. It's trapped within the abdominal cavity. All right, so cryptorchidism. Now let's talk about polyorchidism. And again, polypeptide. What is that? Many peptides. Polysaccharide means many saccharides. Orchid referring to testes in this root word. So polyorchidism means many testes, aka supernumerary testicles. Again, super, so above the normal number of testicles. Now, if you're really curious what this looks like, I don't think I can put it on YouTube. I'm not sure what they do think about medical images, but just look for it on Reddit. So Reddit, and then look up polyorchidism or three testicles. You'll find the picture. But I looked at the picture and I believe it. It looks pretty real to me. But the thing about this, so if you have just one testicle in the scrotum, you have increased risk of testicular cancer. But the interesting thing about, and it's actually very rare to have polyorchidism, but if a man has three, or I don't think I've seen any literature about four testicles, but that they actually have an increased cancer risk or increased risk of testicular cancer compared to men who only have two testes. So and the other interesting thing about polyorchidism is, like, I think in medical literature, if someone has this, it's kind of amazing, because I think in recorded medical journals, I think there have only been about 100 or so cases that actually have true polyorchidism. Now, what other things can affect testicular cancer? Again, so things like genetics. White men actually have 4 to 5 times the risk as African American or Asian men. And the highest risk among Americans and Europeans, and this is not talking about all racial backgrounds. So it's not only genetics, but there might be a lifestyle component as well. So this is comparing Americans and Europeans to other continents around the world. So genetics and lifestyle can increase the risk of testicular cancer. It's not the only factors affecting it. But if you do fall into those categories, maybe you should pay more attention and do these exams every so often. So the thing is that, yeah, so some depending on your genetic background and racial background, you might be at risk of some cancers versus others.